The traditional methods of treating depression are medication and psychotherapy. And so there are different approaches. There's an approach that looks basically at the past and issues that may be unresolved. There are issues of the way that the person thinks aren't very helpful that need to be changed. Often actually exercise has been proven to be a really important component of treating depression. So there's really, even traditional ways of treating depression are quite holistic. You really need to look at the person as a whole. Well, depression, untreated, can be a fatal illness. People, we all know suicide is a possible outcome, and the World Health Organization has actually said that untreated depression is as serious as heart disease in terms of its impact on people's lives, quality of life. It's really quite a terrible illness. And a lot of people who are depressed don't know that that treatment's available and that they ought to be treated, and that could be helpful. And it's not treated, in a common thought, it's a mental illness, so it's not considered as serious, or people get the idea that it's the person's problem, they should just think positively and shake themselves out of it. And this is really not understanding what depression is and how serious it is. Some signs that a person's depression is getting serious and leading towards suicidality is, of course, having fleeting thoughts of, maybe it'd be better if I weren't here, maybe the family would be better if I weren't here, maybe I can't stand this pain anymore. People who are severely depressed become very lethargic and can't get out of bed. They start having hopeless thoughts about the future. They feel helpless to do anything about it. There's often changes in a person's eating patterns. They might lose a lot of weight, or they might alternately start eating a lot and gaining weight. So that's one thing we look for. We look for people losing interest in things that they used to find interesting. So people who are depressed don't really want to do anything anymore. They're not interested in anything that they used to find pleasure in, not interested. They start isolating, don't want to hang out with their friends anymore. There can be an increase in use of alcohol and drugs. Just trying to feel better. Just trying to self-medicate and feel better. Any or all of those things intensifying would be a sign. First of all, if anyone's having any of those symptoms, you would want to try to get help for them. But as they're intensifying, getting worse, that could be getting close to a person feeling suicidal. Families are, we don't really see any kind of mental health problem or substance abuse problem as just the person having it, because everyone exists in a I almost said matrix, but we don't want to use that word because that's a different meaning now. Everyone exists in a web of relationships, and so anything that affects one person is going to affect everything around them. So even a person who's alcoholic, we call it the co-alcoholic, the partner, or when someone's depressed, then of course everyone else around them is worried and trying to help them and so on. And so really nothing exists on its own alone. Well, what we would look for is, for improvement, is we would look for an increasing sense of hopefulness about life, the sleep patterns improving, the drug use and alcohol use going down or disappearing. We would look for the signs of even thoughts about suicide disappearing. We look for a person expressing more satisfaction with their life. We look for someone who starts being interested in things other than activities and having pleasure in life. So it's actually pretty easy to measure when somebody's feeling better.